Hi, I'm Liam, and welcome to A Better Pace, the show that is dedicated to providing you with the best tools and tactics from the alternative health world so you can go and live your best life. On this channel, we provide you with how-to videos on the best self-care techniques. We also will give you alternative health theory so that you can understand your mind-body connection better, and also interviews with modern gentlemen who've all faced adversity in their time. So if you're new here, welcome, and consider subscribing. So today, my first live, I want to talk to you about a very important subject in the world of acupuncture, and one that is very polarizing at the moment. It's about the differences between acupuncture and dry needling. So there are lots of terms that are thrown around at the moment that you may have heard of. So you have dry needling, trigger point acupuncture, medical acupuncture, and Chinese medicine acupuncture. So myself, I'm a practitioner of Chinese medicine, and acupuncture is one of the techniques that we use within that. So just to clear up a little bit about what dry needling actually is. Technically, dry needling is the use of needles without medication for a therapeutic effect, essentially. And at sometimes in the past, it has been known for GPs and physical therapists to use hypodermic needles in order to puncture the skin and get to a trigger point, which is usually a knot in a part of the body. And it sounds incredibly painful to do that because, as I'm sure you know, hypodermic needles are all hollow, and therefore they're quite thick, and they certainly sting when they go in. So the practice is not well, it wasn't exactly pain-free and enjoyable. So wet needling would be needling with medication. That's what happens when you will go and have a vaccine or a flu shot or a vitamin injection. If there is fluid involvement, then that is technically wet needling. So trigger point acupuncture is a system that has been derived from Chinese medicine acupuncture, where you look for knots and lumps and bumps and nodules in different areas, which have they have particular patterns to them. So you'll have a lump and a bump in one area, but you'll have referred pain in another. And once you find that nodule, the therapy is to use a filiform needle, which is an acupuncture needle, in order to get into that space, relieve the tension, relieve the muscle tension in that area, so that you can relieve the referred pain wherever it has moved to. So for me, that's already an important point to make, which is that trigger point acupuncture has been derived from Chinese medicine acupuncture. Chinese medicine acupuncture has been used for, I would say, approximately 1,500 to 2,000 years now. So it has a long history of working in the body and using these needles, and it has many offshoots, of which trigger point or medical acupuncture is one. So this is a good time for me to say hello. Hi, Mum. Thanks for watching. Classic. And Zenat, good to see you. Thanks for the support. I'm trying my hardest not to let my eyes be caught by the chat. It is difficult at times, of course. All right, so the next important thing to differentiate is the training that people undertake for each of the different modalities. And at this point, I do want to say that these are my personal opinions on the matter. I'm not representing anyone else's thoughts. This is just me talking about a very hot topic within the acupuncture world. So don't take what I say as gospel. Do your own research. Look into people that you're working with. That's always very important. Towards the end of the live, I'm going to give you some information that you can use to source good quality practitioners. Anyway, I digress. Hello, Dad. Good to see you too. Okay, so training. Let me have a sip. Training. Now, to practice Chinese medicine acupuncture in the UK, you're required to undertake either a degree level course, a Bachelor in Science. It's an honours degree. This is the course that I completed. It takes 3 years as long as you have some science background. You can do an add-on year, foundation level year to do the science if that's required. Or you do a 3-year licentiate in acupuncture. Either way, the courses cover the same subjects, and the knowledge base that you receive as a foundation is very thorough, not only in the Chinese medicine information, but also in Western medical language. You do very extensive modules on anatomy, physiology, pathophysiology, which is, how the body gets into a state of illness, and also differential diagnosis, because it's important to know things like potential red flags when your clients come to see you. So it's a very thorough course. And within that course, every year you are doing practical modules. So you're learning about how to palpate and how to insert and use the needles correctly. And it's only when you get to your 3rd year that you're actually working on real life patients. So the first 2 years you're working on needling pads and then on each other as students before you get to work with the general public. As a physical therapist, so a sports massage therapist, a osteopath, chiropractor, and I think that there are a couple of others, but I forget. As any of these kind of physical therapists, you already have a grounding in the Western physiological and anatomical information that is deemed to be sound enough that you can learn the practice of dry needling. The problem comes that the professional development courses that are provided for dry needling are not exactly thorough. It is potentially very easy for a physical therapist to go and do a online course of about 12 hours worth of theory and then do a 1-day course where they will go and learn about inserting needles and working on people. And then as far as regulations are concerned, they are free to go and to work with the general public. They're allowed to introduce this technique into their practice. Obviously, there are a full range of courses from the online version to slightly more thorough 5-day courses. It really depends on what institution you're going to, their reputation, and also the cost factor. But it's very easy for the physical therapist to actually gain this qualification. That doesn't necessarily mean that they are qualified to work with people. The amount of conversations I've had with people in the past where I have told them what I do. I work as a Chinese medicine practitioner. I do acupuncture, and I go, oh, I had acupuncture and it didn't really work for me. My instant response is, did you have acupuncture from a Chinese medicine practitioner, or did you have acupuncture from a physical therapist? Because the experience is incredibly different. More often than not, I would say about 80% of the time, the person I'm talking to will respond with, oh yes, my osteo did it, or my massage therapist did it, or my physio did it. And I believe that this is because, even though the trigger point system has been derived from Chinese medicine, the principle of working, the reason, the diagnostic reasoning that goes through the minds of each of the different categories of East and West are completely different. So even though you can take the point structure and implement it into a Western model of how the body looks, you're not considering the Eastern theory about why those points are used in the first place. And therefore, it's a bit hit and miss as to whether the physical therapist will be able to get the desired effect. So that's one of the biggest issues, I think, that it faces people when they go and see a physical therapist who does dry needling, is you're not necessarily sure of the level of experience of that practitioner, and you don't know how often they use the technique. Maybe it's something that they do once or twice a week, and therefore they're not going to have the level of competency that someone who has been through the same kind of training that I have will have in terms of working with the body using needles. So always be considerate of the person that you're going to see. Ask questions. Ask, where did you do training? How long ago was it? How often do you use this technique? What kind of results you get? And if they're not able to answer any of those questions with any level of confidence, then it would be my suggestion that you ask them to stick to the manual therapy that they're trained in. And if you are interested in acupuncture, then visit the British Acupuncture Council website, which I'll leave a link for in the description. And they have a wonderful find your practitioner function. You put in your postcode and you will find any people very close by to you, and they're all qualified to the highest level, and they have very strict health and safety regulations as being part of the membership of the British Acupuncture Council. So that's something to remember. Yes, Zena, thank you. Absolutely shocking. Going to see a physio for acupuncture and having a needle left in the head. Now, put my hands up and say, devil's advocate, you should be careful when choosing a Chinese medicine acupuncturist as well. I would always recommend checking whoever you're going to see out as part of due diligence. The best people to go and see are people that have been recommended to you. And if they have been recommended to you, always check them out anyway. Have a look at their websites, check out their social media profiles if they have them. And the British Acupuncture Council is a great resource. If they are registered with them, you're pretty much guaranteed that you're going to have a quality practitioner there It's a very well regulated body. So that's probably my top tip, is do your homework before you go and see someone, because you never know what you're going to get. Okay, what was my next point? Okay, yes, conditions that can be treated. Now, this is something that's causing a bit of a stir in the Chinese medicine community. As you may or may not know, trigger point acupuncture is mainly used for musculoskeletal conditions. The premise of it being that you are needling a lump, bump, or knot, usually for a pain-related condition. So with Chinese medicine acupuncture, because we treat in a holistic fashion, it is much easier to incorporate many different aspects to the treatment that you're giving. So someone that's coming in with pain, when you look at the whole body and how it has been expressing its disease, very often there may be a root cause to the pain that hasn't been addressed. And you are able to do that using the Chinese physiological system much better. It's not just you're taking all the symptoms into account rather than just where the pain is and just where it's referred to. So there has been advertised fairly frequently, especially in the last couple of years, physical therapists who have a dry needling qualification are beginning to advertise the fact that they can help you with certain conditions that don't fall under the trigger point category. So these can include emotional disturbances, IBS, and fertility and gynecological problems. Now, it's well publicized and well researched that Chinese medicine acupuncture can have significant effect for these conditions. It is not well publicized what effect dry needling can have. And you should be careful if you're seeing a physical therapist that are making these claims, simply because it's only using the Chinese medicine framework, really, that you would be able to achieve these kind of results. So again, this goes back to questioning the validity of what the therapist is claiming, and digging into their research. It's very possible that you will have a physical therapist that is also trained in Chinese medicine, that has done more professional development courses than just a weekend. So ask your questions, probe into their background and where they come from, and if in doubt, seek a specialist. If you are looking for pain-related issues, then go and speak to a pain specialist. If it's IBS that you're looking for, go and speak to an IBS specialist. And you can get those in both fields, in East and West, and get very good ones. But just make sure that you are, again, do your homework. This is the most important thing I could tell you. And that is essentially my advice around this subject. The most important thing for me is don't accept any imitations. Chinese medicine was the original thing. Chinese medicine acupuncture was the original basis for these techniques. So rather than going for a small proportion of what is a system that works amazingly for all sorts of conditions, go and get the real thing. Check out www.acupuncture.org.uk to find out where your local Chinese medicine practitioner is in the UK. I will source where the regulatory body is in the US and where they can help you for that. I believe it's state to state though, so it becomes a bit more difficult, but I'll source that. I'll put it down in the description below. And thanks for watching. If you have any questions, leave them in the chat. And thank you very much for watching.